Let's move into treatment. So coming back to our thesis here, the fact that cells in the body have extra glucose and we need to dump them. There's a couple different ways we can go about this. One is controlling the amount of glucose or carbs we're intaking. Two is fasting, which is going to allow the body to dump the glucose. So let's go into each of those to start and talk about practically how somebody can begin to reverse this.
Yeah, so there's actually multiple ways you can do this. So if you think about the sugar bowl, you know, if you're putting sugar in and your body will burn sugar for energy, well, if you put less sugar in, then that's great because, you know, you're going to have less sugar. Sugar bowl is going to go down, it's not going to spill out. So cutting down the carbohydrates is a very sort of easy and obvious way to get going. And in fact, it's extremely effective. So the American Diabetes Association says of all the diets, the one with the most scientific evidence is the low carbohydrate diet. So there is no diet that has been studied more or has such good results as cutting down refined carbohydrates. So that's basically cutting down sugar, cutting down white bread, white rice, potatoes, and processed foods like that. So that is probably it's easy to understand because, you know, if you think about it, there's this thing we use called the glycemic index, which is a index of if you eat a certain amount of food, how much your blood glucose goes up. And carbohydrates have the highest glycemic index of all foods, right? So if your problem is that your blood glucose is too high, then don't eat the foods that raise your blood glucose. It's sort of obvious. And so I don't know why it took, you know, the American Diabetes Association, like, you know, up until sort of 6 or 7 years ago to really understand, hey, you know, we've known about the glycemic index since the 80s, because I learned about it again in medical school. So for 40 years, we knew that eating bread spiked your glucose. And we still told people to eat bread. It's like, how does that even make sense? Why would you eat the foods that are going to spike your glucose the most? And it wasn't until about 6 or 7 years ago when the low carb movement really started getting going again that people said, hey, this is silly. You should just cut the carbs. And in fact, Dr. David Unwin, who's a physician in the UK, he does that for all his patients. He actually, of the people who follow him, about 50% go into a complete drug-free remission just from cutting out the carbs or cutting down the carbs. That is 50% of the people that he had in his practice that had diabetes, he turned them into not diabetic, right? They came off all their medications and their sugars were low enough to be classified as non-diabetic. That's insane. If you took all his patients, it's still about 25% because not all his patients followed, you know, the diet. So extremely effective, you know, well accepted. The consensus conference from the American Diabetes Association says, yes, you should try that. But there are other ways to do it too. You can do ultra low calorie diets, for example, which is cutting down not just carbs, but everything, right? Because remember that your body can use sugar as a source of fuel. It can also use fat as a source of fuel. If you cut down all calories, and this is using extremely low calories, most of the studies that are effective are cutting your calories to about 800 calories a day. So really, really low. So if you don't eat a lot of fat as well, because fat's a source of calories but not glucose, then your body's going to have to take energy from somewhere. If it doesn't have fat, then it's going to start burning the glucose. So again, lowering that sugar bowl, right? Burning down that sugar. And it can also work. It's just not as easy. That's all. 800 calories a day forever? I don't think you're going to get a huge compliance with that. And then intermittent fasting is again similar. Instead of doing sort of very low calories all the time, like 800 calories a day, you do 0 calories for a certain specific period of time. And what you're doing there, of course, is allowing your body to burn off its the excess glucose. You're allowing it essentially to eat the glucose that you've stored up because that's what it is. It's a source of energy. So if you have a lot of energy sitting as glucose in your body, then let your body use it up. It's no different than if you were to, you fill up your car at the gas station 3 times a day, and now the gas tank is full, but you still keep pumping it. Well, the gas is spilling out into your back seat. It's making you sick. Well, what do? Well, stop filling up. that's basically what fasting is. Stop filling up and let your body use up the glucose. So again, extremely effective if people will do it. But you have to tell people why they're doing it, what they're doing, and what they're doing it for, right? So again, another recent study from this year showed that if you put people on a intermittent fasting schedule, then they in their study they put about 50% of their patients into a complete remission as well. So again, these are extremely effective treatments. There's multiple ways you can do it. There's there's not just one way you can do it. So there's multiple ways, because some people, say, oh, well, the vegans have this other thing, and the carnivores have this other. There's multiple ways to do it. I'm not saying that these are the only ways to do it. And the good news is that if it works for you, then it doesn't matter what works for anybody else. You do it. Like if you want to do ultra low calorie, 800 calories a day for the rest of your life, go ahead, do it. Like you could probably be successful in doing it.
Okay. So to highlight there, we have 3 different methods that you've given us: low carb, intermittent fasting, and cutting the calories. And I want to take some time and jump into each of these for some nuance. Let's talk first about the low carb piece. For somebody that wants to go low carb and use that as a tool to fight back against what we were talking about before, how low carb do they need to go to start? Obviously, it's going to depend on the person, how quickly they want to recover. But to give somebody a baseline to start, and you didn't mention the word ketogenic in there. So I'm curious, is ketosis part of this? Because those two diets are similar, but there is some nuance there.
Yeah, so ketosis is an ultra low carbohydrate diet. So if you think about how many carbohydrates most people eat, it's around 250 to 300 grams per day is sort of an average number that people eat. And that's based on the old recommendations where the American government said you should eat 55 to 60% of your calories as carbohydrates. So people are taking about 250 to 300 grams of carbohydrates, which is fine if it's all broccoli, but it's mostly like, bread and these other highly refined carbohydrates. If you go down to sort of a low carb diet, you're not in ketosis. But if you get down to, say, 100 grams a day, it's a significant decrease from, say, 300 grams a day. And for a lot of people with relatively mild disease, it's going to be enough just to reverse that whole thing, because they're used to putting in triple the amount of glucose into the body, and then if you cut it down to 100. But it's not low enough to get you into ketosis. Ketosis is a process where you have so little carbohydrates. So remember, the body has 2 sort of sources of energy. That's glucose and fat. If you have very little glucose or carbs, then your body will burn fat. And when it burns fat, it generates ketone bodies for the brain. And if you go below about 40 grams a day of, then you're into that sort of ketogenic diet thing. So you don't have to go into ketogenic diet to get good results. But some people like it because then you can measure your ketones, like in your breath and so on. So it tells them that they're sticking to the diet. So when they get into ketosis, they're like, oh, okay, I can measure it now, and therefore I can stay in it and see my progress. And because it's a stricter diet, it's going to give you better results, and it's going to give you better results for very low very, very severe disease. So there's a company that does that, tries to put people into a ketogenic diet for type 2 diabetes, and very successful at reversing it as well.
Okay, second tool you gave is dropping the calories. And I think you threw out the number, and I'm not sure if this is a specific number we need to follow, but 800 calories a day. And I know we've talked about calories in the past, and this one surprised me. I haven't heard you talk about it before, and I know you're not somebody that totally buys into the whole calorie thing. So talk more about why you're jumping onto this and the nuance there.
Well, calories. So there's several trials. Dr. Taylor in the UK has done several trials of ultra low calorie diets, and the thing is that the calories is just a measure of food energy, right? And so the problem is that people focus on it as if it's the answer, right? I mean, you've heard this before. People say it's all about the calories. It's like, no, losing weight is not all about the calories. It's about controlling the hunger that leads you to eat calories, right? Same with these weight loss drugs, right? Ozempic and Wegovy and all these drugs. They don't reduce calories. That's not their primary effect. Their primary effect is to reduce hunger, reduce appetite. And by reducing appetite, that's how you control the calories, right? So it's not that the calories are reduced. It's why the calories are increased. That's the problem. That's what you have to deal with. Just like saying, somebody who says, well, alcoholism, it's all about alcohol in versus alcohol out. And anybody who denies it is wrong, right? And it's like, that's not the issue here, right? So you can't just cure alcoholism by saying, just drink less alcohol, which is this exact same logic that we use for somebody trying to lose weight and say, just eat fewer calories, because it doesn't actually work, right? It's why people are drinking the alcohol. Maybe they're depressed. You have to deal with the depression before you can reduce their alcohol intake. Same thing with calories. Calorie excess and weight gain, they're synonymous. One is not the solution to the other. You're trying to figure out what is causing the excess calories, right? And that's where the hormones and insulin plays a huge role, because if you think about what insulin does, insulin is a storage, it's a nutrient sensor, tells your body that, hey, energy is coming in, store some of it. That's its job, right? So if all your energy goes directly into storage, then you're going to be hungry again. So you're going to go get more calories, more energy, more food. So the problem wasn't the calories you took, is that the calories you took were all going into storage because certain foods raise insulin more than others. So there's an overlap there and there's a nuance there, but what we're talking about is the difference between a root cause and a proximate cause, right? Just like the alcohol. Or saying being rich is just a matter of money in versus money out. And anybody who denies that is all wrong. It's not that there's no money. And then saying education has nothing to do with money, therefore it's irrelevant. It's like, no, education sometimes allows you to make more money, right? So it's not that money isn't important, but the education is what's important, or it's the athletic ability, or it's the, salesmanship, or whatever it is. So, calories is this sort of very low first order sort of thinking, right? What we're trying to do is get into the sort of reasons that the calories are in excess of the others, which is why I always say that, thinking about calories is just, it's simplistic and it's not correct, because if you're just thinking about the calories, you're not going to get to the root cause, which means you're not going to be able to solve the problem. Just like with alcohol, right? You can't solve the problem of alcoholism just by saying, drink less alcohol. It's all alcohol in minus alcohol out. It's the first law of thermodynamics. It doesn't work. Same thing with if you think about why did the Titanic sink, right? People say, well, it hit an iceberg. So the solution is don't hit icebergs. It's like, that's the most useless advice I've ever heard. The solution is to slow down so you don't hit an iceberg, right? It's the same with the calories. If you just say, eat fewer calories, well, you're not getting into the idea of why you're eating those calories. Right? So that's the whole thing. You can do a calorie-reduced diet, and some people do it, which is fine, but you're not getting into the reasons they're eating too much in the first place, right? So it's a little bit nuanced, right? Because the whole idea is that if you're taking foods like refined carbohydrates that have a lot of insulin, a lot of those calories are going to go immediately into storage, right? Just like, say you go to Costco. Now, you have all this food, but you put it immediately into the freezer. But you have nothing to eat. So what's going to happen? Well, you're going to go out and buy some food, right? Same thing. Say you take 1,000 calories, but you spiked your insulin super high. Well, those 1,000 calories go straight into your fat stores. What's going to happen? Well, you're going to be ravenous soon because you have no energy. So, if you eat white bread and jam in the morning, by 10:30, you're looking for something to eat. So then if you count up the calories you ate in the day, you say, wow, you're eating more calories, right? Because you've gone out, you had your white bread and jam, went into storage. So you went out and got another low-fat muffin, went into storage. You went, got hungry, ate a big plate of spaghetti at lunchtime, went directly into, those calories went into storage. Then at 2:30, you're looking for some more, oatmeal cookies and granola bars, goes straight into store. Then you count it up and you say, you're eating too many calories. It's like, but why are you eating so many calories? Well, it's because your insulin levels are spiking and you're storing it all, right? So it's a nuance in terms of trying to get into that, deeper understanding of why the calories are in excess. But if you simply control the calories, yes, it can work, because there's studies that have shown that it works. Does it actually work in real life? No, not at all, because people get hungry, right? You take 800 calories a day, you get hungry. So it doesn't work ever in real life. Don't think we haven't tried it. We've been trying it for like 40 years. We've been telling people to cut their calories for 40 years. Does it work? No, not at all. Theoretically, it will certainly work. There are studies that show that it works.
So it sounds like this isn't something, at least initially, would be a good tool or method to take on. I'm hearing you kind of contrast and give positives and negatives, but in the very end, it seems like because of the hunger piece and maybe underlying issues that aren't being addressed, that this isn't a good method.
If you do it the right way, it can be a good method. If you don't do it the right way. So again, you're exactly right. There's positives and negatives. If you simply cut the fat and eat just carbs that are very low calorie, then it may work. And this is where there's all this debate, right? People go back and forth about, is it calories, is it not? Like, to me, it's already been decided. If the solution was calorie restriction, then we wouldn't have an obesity epidemic. We wouldn't have a diabetes epidemic. If we have the solution in front of us, why would the problem be getting worse and worse and worse over time, right? So to me, weight loss is more about understanding it's more about controlling the hunger, not controlling the calories, right? But it doesn't mean that if you control the hunger, you're going to eat fewer calories. So there's an overlap there that I understand why people get confused. But it's about controlling the hunger, not controlling the calories. That's why Ozempic is ultimately very successful, because it's about controlling the hunger. That's why smoking causes weight loss, because it controls the hunger, and therefore you eat fewer calories. So you have both effects going on, right? Controlling hunger and lowering calories. People debate which one is the most important one. Ultimately, I think it's the root cause is the hunger, and calories is sort of the proximate cause. And you can't treat the proximate cause, right? It's like taking a fever and then taking a cooling blanket. That's fine, but you're not curing any infection, right? If an infection is causing a fever, you can't treat the fever. That's just symptomatic treatment. If you have sort of excessive hunger for whatever reason, which is causing you to eat too many calories, that's eating fewer calories is symptomatic treatment. That's why it doesn't work in the long term, because you have this whole underlying issue that you haven't dealt with, which is the hunger. But if you just simply force people, and again, the studies have been done and they are positive, that's why I bring it up. But it never works in real life, because after 6 months, people just go back to the way they're eating and everything just goes back to the same way. Same as The Biggest Loser, that show that was on for a long time. Nobody ever lost weight long term, like very, very few.
And the other thing that jumps out to me too, as we start cutting calories in the long term, is the impact on the basal metabolic rate.
Yeah, that's very well known. So almost every study in the last 50 years has shown that if you simply follow a calorie-reduced diet, by cutting out fat for the most part, that was the sort of classic strategy for so many years. Your body simply reduces the calorie it burns. So if you eat, and this is the whole thing. People talk about thermodynamics. Anybody who talks about that doesn't really understand what's going on. Imagine that you're eating 2,000 calories, burning 2,000 calories, right? So now you say, I'm going to cut fat. I'm going to take 1,500 calories. Therefore, I'm going to lose weight. It's like, no, you might lose weight or you might not. So if you cut it down to 1,500 calories, every single study we've done in the last sort of 100 years shows that your body will now burn fewer calories. So now you're eating 1,500 and burning 1,500. You're not losing weight. And that has nothing to do with thermodynamics. People say, cut your calories, it's all thermodynamics. You're completely wrong. because if you cut your calories to 1500 and your body cuts how much it's burning to 1500, you're still not losing weight. So it's not thermodynamics. That has nothing to do with it. It's about physiology and how your metabolic rate goes down. We know that cutting calories in that situation definitely does, because that wasn't the ultimate cause. It wasn't the root cause. It's about the insulin, right? If you drop your insulin lower, then generally your body, doesn't want to hang on, because insulin tells your body to store more fat, store energy. So if you have less insulin, you're going to store less energy, which is body fat.
Well, let's move into the third tool, which is the best way to drop insulin, intermittent fasting.
Yeah.
So for somebody that wants to adopt this as a method of, again, taking that sugar built up in the body and releasing it, how do they begin?
You can start by cutting out snacks, and then you can gradually lengthen your fasting period to longer and longer. So you can go 16 hours, you can go 18 hours, you can go 24 hours, you can go longer if you wanted to. Because again, if your blood glucose is high, and again, this is in the situation where you're overweight, where it's type 2 diabetes, not type 1 diabetes, as long as you have lots of sugar, then your body has an ample store of energy. So why are you putting more energy into your body when you actually have too much energy? Right? So if you simply don't eat, your body needs to burn that glucose for energy. If it burns the glucose, then that's good, right? You're burning down that sugar bowl. And the thing is that it's very flexible, so you can do whatever you really feel is appropriate. You can do 16 hours, you can do 20 hours, you can do 24 hours, you can do 2 days, you could do 4 days, you could do 7 days. You could, do it sometimes and not do it sometimes. You could do it only when you're gaining weight, right? If you had a vacation and you gain weight, then you can do more. If you're, if you're at a good weight, then you can do less. So it's sort of infinitely flexible. And really it's a tool that people can use to control their type 2 diabetes. And it's really because fasting means eating zero. And you can't go lower than zero. It's really the most powerful tool that we have. Really, there is no more powerful tool. The question is, how much do you need to do, right? And that's all going to vary. Like, you have to see your own results. If 16-8 does fine for you, then do 16-8. If it's not doing fine for you, do more, right? If twice a week is not enough, you can do 4 days a week, right? You have to individualize it to yourself. There's no sort of one size fits all.
For somebody that may still be hung up on the basal metabolic rate that we were talking about before, let's pull that into the fasting conversation. So for somebody now that is, say, theoretically, they could be eating the same amount of calories as they were before, they're just condensing that eating window and having them within 6 or 8 hours. So talk about basal metabolic rate in that case. And we already went into it on calorie restriction.
Yeah, so basal metabolic rate doesn't tend to go down as much, because when you're not eating, when you're fasting, your body actually increases its sympathetic tone. So noradrenaline goes up. So therefore, it's going to keep your metabolic rate relatively preserved compared to simple calorie restriction. So if you look at, if you take somebody and you fast them for 4 days, for example, and they've done this study, they measure their metabolic rate before fasting, so at time 0, and then 4 days of zero food, they measure again how many calories they're burning in a day. And it didn't go down, it actually went up by 10%. So your body's actually burning more calories in the fasted state, simply because of these other hormones. So again, if you're keeping your metabolic rate high, and you're trying to lose weight, that's a huge advantage in trying to lose weight compared to calorie restriction, where we know that metabolic rate is going to drift down from 2,000 calories, which you started, and it's going to drift down. And that's how people, I've seen lots of people who have measured their metabolic rate, for example. And a lot of people who have had these yo-yo diets for so many years, they're sitting like 1,000 calories, 1,200 calories a day. It's extremely low. They're cold a lot. They don't have a lot of energy because they're not burning a lot of calories. And the problem is that the way they went, about losing the weight, which is cutting down the fat, calorie restriction, their bodies basically shut down along with their caloric restriction. So And again, there's been multiple studies which show that anytime you decrease calories, just calories, like, the amount of calories that you're going to burn is also going to go down. So you can go very low. Like if you think you can go down to 1,000, that's very little. It's like very little food. And people say, well, how can you be gaining weight on that little food? It's like, yeah, because their metabolic rate went down even more, right? That's the only way it actually happens. So yeah, that drop in metabolic rate can be very, very severe, and it can be a huge detriment in terms of that. So intermittent fasting is a very good way to keep that up. Same thing with low carb, because you don't necessarily have to restrict calories.
One of the other things I could see people fearing adopting intermittent fasting and having that narrowed eating window is their muscle mass. So for somebody that has listened to some of my other conversations and learned about, and it's everywhere out there on the internet and elsewhere, the importance of muscle mass, especially as we age, for somebody that is fearing that when they're eating within that window, what would you say to them?
Yeah, there's a few reasons why people get worried about muscle mass, but really it's really overblown, I think, because muscles grow or don't grow based on how much you use them, right? It'd be great if I could just eat and gain muscle. It doesn't work that way. And it doesn't work the opposite either. It's not like you stop eating and your muscles stop, growing, because your muscles respond to how much you're using them. And if you're using them a lot, like lifting weights, they get bigger. And if you're bed bound, that is, you're not even, supporting your weight against gravity, your muscles weaken very rapidly within, a day or two. You start losing muscle mass extremely quickly. So the whole idea is that what you eat and don't eat is a relatively small contributor to your muscle mass. It's not like your body says, oh, okay, well, I'm going to store energy in the form of glucose, in the form of fat, and then when I need it, I'm going to burn muscle. It's like, we'd have to be idiots to do that. Our bodies are just not that stupid. So it's really all about, and part of the problem is that it's all these sort of people who like to measure their muscle mass and lean mass and so on. And what happens is that during fasting, and there was one study that showed this, they took people, they fasted them for 10 days, they measured their muscle mass, and sure enough, their muscle mass went down 30% or something scary like that. But when they actually tested muscle strength, it didn't go down, it went up. And it's like, well, how does that happen? And they're like, well, because what's happening is that a lot of the muscle glycogen is being burned off, right? Glycogen is a chain of sugars, and muscle glycogen is not related to the glucose that's in the blood. It's sort of segregated. So as you lose muscle glycogen, you lose muscle water. So then when you measure it with bioimpedance, what you see is a shrinking of muscle. But it's not. It's just the muscle glycogen. So I've had somebody who is super worried about it, for example. And it was a weird, so he did a fast. He checked his body, his before and after. And what he found supposedly was that his truncal muscles dropped by 10%. So in like a few days. It's like, okay, but he didn't feel any different. Didn't do any more or less exercising, lost, 10% of muscle mass. That's weird. But then when he started eating again and then he redid it, his muscle mass went up, 10%. It's like, so you think your muscle mass went up 10% by not exercising any more or less than you did before, right? How does that work, right? And it's just the difference in muscle water, muscle glycogen that probably explains it. It's the way we're measuring muscle mass and lean mass that is throwing off our thing. And then people, with a little bit of knowledge, they go, wow, it's causing muscle loss. It's like, that makes no sense whatsoever, right? If you think about it, we would have all died long time ago if we lose muscle mass during fasting, because when we're cavemen and cavewomen, There's many times during the winter that people don't have enough to eat. There are probably lots of times they go several days without eating. If every single time you do that, you lose muscle and gain fat, everybody would have lost all their muscle mass like by the time they're like 15 years old, right? They'd just be little blobs of fat running around the American plains, right? Or, the Kalahari Desert and stuff. Those people who routinely fast and feast because of, winter and summer, and if they catch game or don't, they should be little blobs of fat. All these native tribes and stuff that are, in the Amazon that are away from civilization, they should be little blobs of fat, but they're not. They're lean, they're muscular, they're well built, right? Because fasting doesn't really cause muscle loss.
All right, Jason, I know you got to go, but we got to part on this. We got to come back to our underweight person who is suffering with type 2 diabetes. And the 3 different strategies we went over again are cutting back calories, fasting, and cutting down on carbs. All 3 of those are going to generally lead to weight loss. So for our person out there who's type 2 diabetic saying, I don't have any weight to lose, how do I go about using these tools without shriveling down to nothing? And I'm curious, as somebody who's in this world, how often you see that?
I see it fairly often. And again, most of the time people actually have to lose some weight. Even though they're normal weight by body mass index, they actually have that abdominal fat that needs to come down. And that's where low carb, intermittent fasting are very effective. Low calorie, again, it's been proven in studies to work, but practically it doesn't almost ever work in the real world. So even though it can theoretically work, it's relatively hard to do. And I'd say that I almost never see anybody successfully do it using a low calorie diet. But as I said, there's reasons why it's not working well. But for most people who are in that situation, a low carb diet, which is not necessarily calorie reduced, can be very effective. Intermittent fasting, again, can be very effective in those situations too. But most people do wind up losing some weight that they didn't think they had, to lose, but they do. And it's all from the abdominal fat.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
Insulin's pushing harder, it's pushing harder, it's pushing harder, but at some point it reaches its limit, and then no matter how hard insulin pushes, you can't shove any more glucose into that cell, and therefore that's when the glucose winds up in the